Okay, let's get started. Hello, my name is Linda Simone, and I am pleased to welcome you to the third webinar in HMS's series on healthcare reform. Today's topic is child support and healthcare reform. During the webinar, all lines will be muted to avoid any background noise. If you'd like to ask a question, please do so at any time during this presentation. Simply use the Send Question to Staff feature in the control panel. We'll address your questions at the end of the presentation. Our goals for today's webinar are first, to provide an overview of the environment created by healthcare reform legislation. Second, to educate child support agencies and other interested parties by increasing awareness of the issues and by discussing the impact reform legislation will likely have on child support. And third, to encourage child support agencies and Medicaid, CHIP, health insurance exchanges, and other programs to work in harmony to benefit the children affected. Joining me today to address the issues are Erica Pierce, HMS's Director of Federal Government Relations, and Barb Saunders, Vice President for HMS's Child Support Services. Erica is responsible for developing HMS's Federal Government Relations Program, a vehicle for supporting legislation that promotes healthcare expansion and efficient government healthcare spending. She'll present an overview of the Affordable Care Act in relation to the Child Support Program. Barb has 23 years as a child support professional, having worked at the local, state, and federal levels. Now working in the private sector, partnering with child support agencies to improve overall medical support performance, she's uniquely qualified to offer her observations and provide greater detail on the specific provisions of the law as they impact child support. So let's start with Erica.
Thanks, Linda. Approximately 17 million children are in the child support program. That's nearly 25% of the 72 million people in our country under the age of 18. This program is designed to enhance the well-being of children and reduce the demands on public funds by securing child support and medical support from legally responsible parents and by encouraging positive relationships between children and their parents. The child support program plays a major role in determining if and how these children have health coverage. In the wake of healthcare reform, it's important to discuss and understand the impact of the federal healthcare reform legislation on the child support program. Since the passage of the Affordable Care Act almost 1 year ago, a number of states have created healthcare reform implementation committees and councils. These entities are charged with mapping out many of the new requirements for states, such as the Medicaid expansion and creation of health insurance exchanges. These coordination committees and councils are often comprised of various agencies and stakeholders within the state. They usually include representatives from the Medicaid and CHIP agencies, Department of Insurance, Department of Health, as well as key officials from the governor's office. One observation we've made is that officials from the state's child support programs are not usually represented in these groups, even though child support plays a vital role in the healthcare system in each state. Because establishment and enforcement of medical support has long been a core service of the child support program, it's important for those who are making healthcare reform policy and operational decisions to understand the importance of the child support program and to include key officials in the implementation process. For example, the healthcare reform coordination body should understand that child support orders are mandated to include a provision for medical support, which usually requires one or both parents to provide health insurance coverage or cash payments to cover the cost of insuring the child. In cases where a child is covered by Medicaid or CHIP, the parent may be required to reimburse the state for the child's coverage or enroll them in private coverage, if appropriate. Under federal health care reform, we anticipate that states will be able to conduct a more in-depth analysis of the health insurance or other medical support options available to each parent, considering cost, accessibility, and completeness of coverage. What this means is that as states develop and roll out health insurance exchanges, the exchanges must coordinate and share data with the child support agencies in order to properly assess and enforce medical support orders. This webinar is an effort to start this dialogue and to discuss and provide an analysis of the Affordable Care Act on the child support program. We've invited stakeholders ranging from child support officials to state health care reform officials in an effort to ensure that all entities are working together towards the common goal of ensuring and expanding health care coverage to those who need it most. Now, Barb Saunders will discuss specific health care reform provisions and the impact they'll have on child support enforcement. Barb?
Thank you, Erica. We've got a lot of ground to cover in the next half hour, so let me start with a brief overview on what the Federal Office of Child Support Enforcement, which I'll be referring to as OCSE or the federal government, is considering in response to health care reform. Our focus today is from a child support perspective, discussing what agencies should be thinking about and considering as health care reform unfolds. Here's what we've been hearing from OCSE at child support conferences over the last year. The message has stayed pretty much the same. They've shared with agencies the part they will play as health care reform is implemented, as well as their goals and initial thoughts on next steps. OCSE has stated two goals. First, to expand health care coverage for children, which is what we all want to see, and second, to harmonize medical support and health care policy, which is, of course, the heavy lift for OCSE and what states need to pay the most attention to. The federal government's focus can be summarized in these 4 points. First, determining what child support's role could or should be. Second, clarifying state flexibility to improve how it operates with Medicaid and the Children's Health Insurance Program we call CHIP. And on this point, we want to mention that Commissioner Turetsky, having come from the advocacy world, is a strong proponent of public health care. She advocates for increasing public health care enrollment and extending retention for families on the child support caseload. And also, remember the release of AT 1010, which allows states the option to amend their state plans to define health insurance as including, and I quote, other health care coverage such as Medicaid and CHIP, as well as private health care coverage. Third, seeking partnerships and collaboration with CMS, states, and health insurance exchanges by encouraging outreach and referral services from child support to Medicaid, and examining barriers to data exchange. And fourth, examining and possibly updating medical support guidelines, policies, and regulations. OCSE has reminded states that they're still required to provide medical support enforcement services in compliance with all current statutory requirements. And in addition, they've recently proposed rules on changes to the National Medical Support Notice, which I'll refer to as the NMSN. So where does this leave state agencies? We've identified the key child support-related provisions from the Health Care Reform Bill. So now let's discuss some observations and the potential impact on your programs. First, here's the good news. Health care reform means more kids with health care coverage, and that's what we all want to see. But as they say, the devil's in the details, and here are some of those details. With private health insurance now available to all individuals through increased employer offerings or individual policies offered through health insurance exchanges, there's the potential for an increase in new medical support orders. During the establishment phase of a medical support order, parents, with minor exceptions, will no longer be able to report lack of access to insurance as a reason to avoid a medical support order. Along with this new emphasis on parental responsibility, we expect to see a shift towards an increased number of custodial parents being ordered to provide coverage rather than the non-custodial parent. This could cause agencies to rethink their current enforcement policies and the use of the NIMSIN to enforce coverage by custodial parents. For the same reason, agencies will most likely be faced with an increased need for order review and modification. With almost 8 million medical support orders in the child support caseload, agencies could be faced with increases in administrative costs and a change in staff deployment and workload. On a final positive note, with this individual mandate and increased availability of private insurance coverage options, ordered parents are more likely to comply with their medical support orders, and that's a good thing. Also within Provision 1501 is the requirement that parents who claim a child as a dependent for IRS purposes must prove coverage for the child or face a tax penalty. This is the enforcement piece of healthcare reform and probably the most thought-provoking section of the bill because it could significantly impact the child support program. This provision has caused the federal government to ask a number of questions. What is the role child support has in this new world of healthcare reform? And should the enforcement burden be shifted away from child support and assumed by the IRS? There are a number of potential impacts and many other questions that must be answered quickly as healthcare reform unfolds. Again, let's start with the good news. With this additional layer of oversight, compliance with medical support orders should increase, resulting in more kids with coverage. Ordered parents will be facing consequences from two different directions, the IRS tax penalty and child support, with its strong enforcement measures for noncompliance. But there are questions that need to be answered and resolved between the two programs. There appears to be a potential conflict in the law. Currently, the vast majority of child support orders, over 10 million, as part of the child support obligation determination process, gives the custodial parent the right to claim the child as a dependent for tax purposes. The non-custodial parent, more often than not, is the one ordered to pay the child support obligation and provide insurance coverage if it's available. So here are the questions. How will the custodial parent obtain coverage information if the non-custodial parent is ordered? What agency will be required to assist the custodial parent in obtaining the information? Where do the courts stand on the tax issue? Who will decide and how will this conflict be resolved? Court and administrative medical support orders specifically require child support enforcement agencies to enforce medical support compliance within 30 days of a lapse of coverage if coverage is found to be affordable and available. IRS compliance currently reads a gap of 3 months or less in a tax year. These differences in compliance requirements between the IRS and the child support program will need to be harmonized so the two programs won't be working at cross purposes to each other. In addition, IRS enforcement